This is Drew. He is up for adoption, and he's pretty stinking cute. Yeah. Hey. My name is Crystal Shane. I work at the Saskatoon SPCA as a Registered Veterinary Technologist and have been so for 3 years and have been here for 4 months, and it has been a wonderful ride. You're pretty extra fluffy. Hey? Meow. Meow. Go down. Good job. Yeah. Sometimes it looks like we're just petting them, but we're actually checking to see if they are too skinny or if they're a little bit overweight. So we just want to feel their ribs, see if we can feel a little bit, and their hips. This one's actually pretty good, mostly fluff, but. And then we check inside their ears. With these little guys, they often get ear mites, so we want to make sure that they're nice and clean, which they are. And we check their eyes to make sure that they don't have any discharge coming out of it, as well as their nose. And then the fun part is their teeth. Since they're really young, this one is probably only about 8 weeks old. You want to make sure that their baby teeth are all coming in properly, which they are. And then just some extra cuddles. According to the SVMA, cat neuters aren't an invasive surgery since they don't have to go inside the body cavity. So veterinary technologists like myself and the other 2 that work here, we're able to actually do those in-house. That also allows us to save a lot of cost too, since we don't have to send them out anywhere, we can just do it ourselves. And then that lets us to spend more money on these little guys that we do have to send out for their surgeries. So especially with cats, being transported back and forth is extremely stressful for them, being quite sensitive beings and such. These little guys, it's still, we try not to send them out more than they need to be, so that's why we do all of our medical exams here in-house as well, and he'll just go out the once for his surgery. So this guy is a little lab puppy is what we speculate. Before he went onto the adoption floor, we have to give them a full physical exam. We start off with their vaccines as well, so his puppy boosters, and then he will be neutered before he's able to go home. So with these guys, we just have to, again, check to make sure that they're not too thin, which this guy is very well fed. We check inside their little baby ears. Yeah, and their eyes. And their teeth as well. Some of the dogs or cats will come in and they might have teeth that are broken, and we have to make sure that there isn't any kind of pulp exposure, so we can check and see essentially if the source of blood in their tooth is exposed to make sure that they're not in pain. And then we'll also have to make sure that they don't have any umbilical hernias here. So we just kind of feel to make sure that his cute little tummy that gave him the hiccups. And then we can also listen to their heart to make sure that they don't have any heart murmurs or anything like that, and that they're not coughing or showing signs of kennel cough. No, thank you. These little guys were so funny. If they have any kind of diarrhea problems, we can look under the microscope and see what's going on so we know what to treat it with, as well as ear infections, which are really common in our tomcats that come in and have been in a couple of fights. And we can make a couple of slides and take a look under a microscope so that they're being treated in a faster manner. I can be outsourced to one of our animal hospitals that works with us closely. And then I do the cleanings, the extractions, everything like that, so that when the owners do adopt, they don't have to incur those costs themselves. It's all completely included in their adoption fees. And their adoption fees are not made more just because they had dental extractions or anything like that. With the older animals, when we do our physical exams, they are a little bit more intrusive, I guess. We just have to make sure that we are looking through their joints and seeing how their legs bend and such like that to see if they're suffering from arthritis or anything like that. Good job. He's a little stiff, but he's a pretty old guy, so he's doing pretty good. Good boy. Yeah. We had a dog come in who was owner surrendered. She was 10 years old, and she had a little bit of some arthritis and her hips were a little bit sore, and she also had a few teeth that were pretty dirty, one of which needed to come out. So since we are able to save money in doing our dentals ourselves, we were able to get her teeth completely cleaned, extract the one tooth that needed to be, and she ended up being adopted as soon as she was put back onto the floor. So it was really nice seeing that the senior pets are also cared for here.
Oh, is that the spot? Is it the spot? Oh, that's good.
I decided that I wanted to be a vet tech because I like to help the little guys that can't talk for themselves. And since working here in August, I actually have found that it's even more rewarding because it's a place where you see these guys come in and they're from all different kinds of backgrounds, obviously, whether they came in as a stray or transferred from up north, and we get to help to make sure that they find the best home possible as well. Oh, thank you. Ooh.